GREENCARE A1c is a point-of-care analyzer for measuring glycated hemoglobin in human whole blood. With only a few simple steps, the GREENCARE analyzer delivers accurate results in less than 5 minutes. Its built-in thermal printer, touchscreen, and audio guide make it easy to use. The fully automated analyzer is designed specifically to meet the needs of diabetes clinics, hospitals, and laboratories. Here's a description of the analyzer and test kit. The GREENCARE A1c box contains the analyzer, check kit, a usual manual, a power supply, a power cable, and one printer paper roll. The GREENCARE A1c test kit box contains 10 test kits, an insert paper, and a quick guide. Each test kit comprises a cassette and reagent pack. The test kit can be stored at room temperature for up to 12 months from the manufacturing date. First, connect the jack to the analyzer. Then turn on the analyzer by pressing the power button. Within 5 minutes, the analyzer will be ready to use. When using the built-in printer, insert the printer paper roll at the front of the analyzer. Make sure the paper is facing upward. Open the cover. Insert the check kit into the cassette holder and close it. Less than 2 minutes, the check test is done and the result appears on the screen. Press the OK button and open the cover to remove the check kit. If unsuccessful is shown on the screen, please contact your local distributor. Now you are all set to run GREENCARE A1c. As a reminder, medical gloves should be worn while operating. Capillary blood and venous whole blood samples can be used in the GREENCARE A1c test. The sample volume is 3.5 microliters. To obtain optimal results, please follow these procedures thoroughly. Let's first begin with how to use capillary blood samples with the GREENCARE A1c. Open the foil pouch. Once test kit is opened, it should be used within 10 minutes. And please do not touch the cassette measurement windows. Gently lay the reagent pack and cassette on the bench. Before pricking the fingertip, insert the cassette into the cassette holder with a barcode facing to the left. Select the puncture site on the middle finger of either hand. Using the alcohol swab, clean the finger and allow it to dry completely. Then, prick the fingertip using a lancet. Firmly press the lancet against the puncture site. Apply gentle pressure, massage the lanceted finger vertically from the base of the finger toward the lanceted fingertip to form a drop of blood. Gently shake the reagent pack 5 to 6 times before collecting the blood sample. Visually check that there are no lumps in the reagent pack. Use the capillary to collect a drop of blood. The blood will be drawn automatically. Please collect the blood from the surface of the blood drop. That way, you can avoid air bubbles and excess blood sample on the outside of the capillary. When you fill the capillary completely with the patient's sample, then place the reagent pack into the cassette with a U shape facing to the left. When you insert the reagent pack, please ensure that you apply pressure evenly and gently, holding the analyzer with both hands. Be sure to close the analyzer cover within 5 seconds. When the analyzer cover is closed, the analyzer automatically runs HbA1c test. In less than 5 minutes, the result is displayed on the screen and is printed out through the built-in thermal printer on the front. Press the OK button. Open the analyzer cover by pressing it. Then remove and discard the used test kit from the analyzer. Close the cover manually when the analyzer is not in use. A screensaver will appear after 10 minutes of non-use. To reactivate, just tap the screen. You can also use venous samples to measure HbA1c. Remove the venous samples from the refrigerator and wait until they have reached room temperature. Venous samples can be stored in the sealed tubes for 1 week at 2 to 8 degrees Celsius or for 3 days at 21 to 25 degrees Celsius. Please do not use hemolyzed, coagulated, or diluted samples. Gently mix the sample by inverting the tube 8 to 10 minutes before using. Insert the cassette into the cassette holder with a barcode facing to the left. Lay the sterile laboratory film on the bench. Pull out the tube cap and put a drop of venous sample on the film. Gently shake the reagent pack 5 to 6 times before collecting the venous samples. Use the capillary to collect a drop of venous samples. Please collect the venous samples from the surface of the sample. That way, you can avoid air bubbles and excess blood sample on the outside of the capillary. If too much of the sample gets on the capillary, use a cotton swab to wipe off the excess. But make sure the cotton swab does not touch the tip of the capillary. If this happens, some of the sample may be absorbed onto the swab. Insert the reagent pack into the cassette and complete the procedure as introduced for the finger stick samples. Control solution tests confirm that the GREENCARE A1c system is in good condition and providing accurate results. To ensure the analyzer gives accurate results, control solution tests must be carried out periodically, and the test results must be within the acceptable ranges. Kindly refer to the user manual to learn the recommended frequency of control solution tests. To purchase the control solution, please contact your local distributor. To run the control solution test, press the control solution button on the menu screen. Open the cover by pressing it and insert the cassette. Choose the level of control solution indicated on the control label and press the OK button. Set the range of control solution indicated on the control insert paper and press the OK button. Then lay the sterile laboratory film on the bench and put a drop of control solution on it. Gently shake the reagent pack 5 to 6 times. Insert the reagent pack into the cassette and complete the procedure as introduced for the finger stick samples. Once the control solution test is done, check the results by pressing the Setting button on the menu screen and following Setting button, Cogwheel button, then the Control Data button. The results of the control solution test will then be displayed on the screen. Please make sure that the measured values are within the acceptable range given on the insert paper. In rare cases, you may see error messages on the screen during the procedure or after the test. In such an event, please refer to the user manual for details and troubleshooting methods. If the problem cannot be solved, please contact your local distributor. GREENCARE A1c. We never compromise on product quality.